Tammy, and your name is?
Catherine.
Hi. So I'm here to do a head-to-toe assessment on you. I have washed my hands, I have my gloves on, you have your mask on, I see, and so do I. I just want to know your name again.
Catherine.
And what's today's date?
October the 18th.
Okay, and then who's the president?
Trump.
And then what city are you living in?
Las Vegas.
Okay, all right, so the client is alert and oriented ×3. Her speech is clear and concise. She's dressed appropriately for the situation. She's well kept, is polite, and is sitting in an upright position with no acute distress noted. Okay, today during the head-to-toe assessment, I'm going to be inspecting you. I'll be palpating you. I will be auscultating, which is listening to you. But if at any time you feel any discomfort or pain, please let me know, okay? Okay?
Yes.
Okay. So I'm gonna go, I'm gonna start off by looking at your head, all right? I wanna inspect your head. Okay, her head is normal cephalic. Hair is soft and shiny, evenly distributed on the scalp. No masses noted or lesions, and there's no signs of infestation. So I'm going to look at your face, okay? Just look straight ahead for me. Straight ahead. Perfect. Okay, her face is aligned symmetrical bilaterally. Her eyebrows and lids are evenly distributed and no ptosis noted. Okay, I'm going to touch your face to check your sinuses. Okay. Any pain or tenderness?
No.
Okay. So the patient shows no tenderness. Her skin is warm, dry, intact, and normal for race and ethnicity. No tears, abrasions, swelling, or abnormalities. The next thing that I will be doing is I'm going to have a look at your eyes, okay? All right, so I want you to go ahead. I'm gonna place my thumbs on your lower lids. Go ahead and look down. I'm gonna press I'm gonna put my thumbs on your upper lids. Look up. Perfect. So the client has no crusting on her eyelids, no abnormalities or exudates or drainage. Now I'm going to press on your inner eyes for any tenderness, okay? Let me know if it's too rough. Any pain or tenderness?
No.
Okay. So the lacrimal apparatus is non-tender to swelling, no ptosis. Sclera is white. The cornea and conjunctiva is clear and intact. Iris is round bilaterally, and no drainage or exudate observed. I'm going to look into your eyes with a pen light, so please look straight ahead. Let me get my, should have had this ready. Let me get this. Hold on. Still can't find my pen. Okay. All right. So just look straight ahead, please. Look straight ahead at me. Look straight ahead at me. Thank you. It's doubling as my pen light. Sorry. Okay. So, pupils are equal and reactive. Pupils are equal, round, and reactive to light and accommodation. The cornea is symmetric with light reflex. Look straight ahead. I'm going to go ahead and do the cover on cover test. Okay, so go ahead, take one hand, cover one eye, and leave the other eye open. All right. Perfect. All right, and nose strabismus noted. The next test I'm going to do is look into your eyes with a ophthalmoscope, which is what I actually had. And I just need you to look straight at me, okay? Glasses. Look straight at the light, please. Perfect. Okay. So the light reflexes are present. Optic disc is sharp margins and no hemorrhages noted. The next test that I'm going to do, you okay? Still okay? Okay, so the next test I'm going to do is I'm going to just look at your ears. I do see your ears are symmetric. They are aligned with the outer canthus of the eye. I'm going to look inside your ears, okay? Let me just switch this again. I'm going to pull your ears up a bit. When I inspect the outer ears, they are normal for race and ethnicity. There's no redness, swelling. The ears are dry with no drainage noted. The external ear canal is dry, and the tympanic membrane is intact with no signs of trauma or infection. It's pearly gray, and the cone of light is present. The left tympanic membrane is at 5 o'clock, and the right one is at 7 o'clock. Now I'm going to look at your nose, okay? So I'm just going to look up your nose. Perfect. Okay. So the nose is midline. Both nares are patent. Mucosa is pink and moist. No septal deviation. No drainage noted. Now we are going to go to the mouth and throat. Okay. The lips are pink. Go ahead and smile for me. Just show me your teeth. Okay, so the teeth are aligned, gums are pink, moist with no exudate, no signs of swelling or bleeding. I'm gonna tongue depressor. Sorry, step that away for a second. Get a tongue depressor. The uvula, uvula rises with formation. The hard and soft palate is smooth and pink and moist. Say ah.
Ah.
One more time.
Ah.
Okay. The tonsils are 1+ bilaterally. No swelling or patches noted. Her tongue is moist and pink with no inflammation, no buildup. Her floor palette is pink moist with no red patches. I'm going to ask you to open and close your mouth. Wide and shut. Wide and shut. Okay, perfect. So her TMJ is without crepitus, no clicking, and she has full range of motion of the TMJ. So the next, now I'm going to ask the client to swallow. I'm going to check her thyroid. Okay, so I asked her to swallow to check her thyroid. Now I'm just going to feel your thyroid here. Do you mind standing up for me? Okay, her neck is midline. As you can see, no deviations observed, no masses. Skin is warm, dry, and intact. No lesions, no redness or swelling noted. Okay, I'm gonna go ahead and ask you to swallow one more time. Perfect. So the trachea is midline, no deviation. Go ahead and sit down for me. And this way. No JVT noted. Okay, now I'm gonna go behind you and check your thyroid, but I already did that. Okay, so I'm trying to limit the times you have to get up and down. It's patent when she swallowed, so no concerns there. Now I'm gonna ask you to place your chin to your chest. Move your head back, then forward, right to left. Perfect. The neck has a full range of motion. Okay. The next part of the exam, I need you to take, we're not going to have you take your top off, but I'm going to just examine you, okay? Just out the way, just out the way. Okay. Okay. You're fine. Okay, so I'm gonna check the lymph nodes. The first lymph node I'm gonna check is the occipital, the post-auricular, the preauricular, tonsillar, submandibular, submental, anterior cervical chain. And as I get further down, I'm going to assess the deep cervical chain. And this is hard to palpate, so that's normal. Then the posterior cervical chain. And then the last one is going to be the subclavicular lymph nodes, which is right above the collarbone. Any tenderness, pain, swelling?
No.
Okay, I feel no tenderness, no enlargement, no nodules. Okay, now I'm going to ask you to turn around with your back facing me because I'm going to look at your back. Turn around and stand up. And face the window. Okay, her back is symmetrical. There's no curvature. Go ahead and take a deep breath for me. And again. Okay, her breathing is unlabored, no heaves, no use of accessory muscles, no retractions. Her skin is, like I said again, dry, intact, normal for race and ethnicity. Go ahead and take 2 deep breaths for me. And again. Okay, chest is symmetrical with expansion. Okay, now I'm going to listen to your lung sounds in 8 different areas, okay? And each time I want you to say E.
E. E. E. E. E. E. E. E. E.
Okay, so lungs are clear to auscultation. There's no consolidation. Okay, so go ahead and sit down. Thank you. And before I have you sit down, please stand up for me one more time. Okay. Say 99.
99. 99. 99. 99.
Okay, tactile fremitus is clear. Vibration, no consolidation. Lung sounds are clear to auscultation bilaterally, and no adventitious sounds. Okay, so when I did it, I asked her to say 99. I did it in 4 different spots going down her spine. Okay, alrighty. I have a seat. Alrighty. Alright. Okay, sorry. Alright. And sorry, let me take a look at my sorry. Okay, I'm gonna just look at your chest. Your chest is symmetrical, no deviations. It's symmetrical bilaterally, no deviations. The skin is dry and intact, no heaves, no use of accessory muscles. Okay, I'm going to listen to your lungs. Deep breath in, out, again in, out, again in, out, and again in, out. So again, breath sounds are unlabored, equal bilaterally, clear to auscultation. Okay. Right now, I'm going to check your pulses. The first pulses I'm going to check are the carotid pulses. These pulses I'm going to check in practicum. It would be for 60 seconds each. For the purpose of this video, I'm going to just check the pulses for you. The first ones I'm going to check are the carotid pulses. Carotid pulses 2+ bilaterally. The next pulse I'm going to check is the radial. 2+ bilaterally. Next one is the popliteal. Relax your leg. Just relax. Thank you. Can you see? Okay. 2+ bilaterally. Dorsal pedis. And sometimes these could be hard to feel, but they're 2+ bilaterally. And the femoral. Go ahead and lay down for me. And these pulses are 2+ bilaterally. Okay. Go ahead and sit up for me. gonna listen to your heart sounds. So we're gonna start off with the aortic, pulmonic, Erb's point, tricuspid, mitral, and aortic, pulmonic, Erb's point, tricuspid, mitral. Okay. Aortic, pulmonic, Erb's point, tricuspid, and mitral. So I know the location of the the aortic pulmonic. The aortic is on the right sternal border. Pulmonic is on the left sternal border. Second intercostal space. The Erb's point is in the third intercostal space. Tricuspid is in the fourth intercostal space, left sternal border, and then the mitral is in the fifth mid-clavicular intercostal space. Okay, and there's no there's S1, S2, there's no S3, S4, no murmurs, no gallops. Okay. Okay. Go ahead and let's see. Let's see. Let's see Any swelling? No. Perfect. Okay. So what I was doing, I was looking at her extremities. No extremities. No edema. No edema in her extremities. Now I'm gonna look at your abdomen. So I'm gonna have you lay flat. Her abdomen is flat. It is non-distended, no pulsations. It's symmetrical, no masses, redness, lesions, and her skin is warm, dry, and intact, consistent with her race and ethnicity. Okay, I'm going to listen to all four of her quadrants. I'm going to start with the right lower, left upper, and then right upper. So, right lower, left lower, left upper, and right upper. Vowel sounds are present in all four quadrants. Now I'm going to listen to the vascular sounds with the bell.